NCLEX RN Practice Test Book. Question 1. Set 1. A patient is scheduled for surgery. When should the consent be signed? In the OR, after the sedative is given, before any preoperative medications are administered, in the recovery room. Consent must be signed while the patient is alert and not under the influence of mind-altering drugs. Question 2. Set 2. What is the golden hour in newborn care? The first hour after birth for skin-to-skin and bonding, the first hour of active labor, the first hour of the second stage, the hour before discharge. The first hour after birth is critical for bonding and initiating breastfeeding. Question 3. Set 3. Which insulin is considered rapid-acting? Lispro, NPH, Glargine, regular. Lispro, Humalog, is a rapid-acting insulin with an onset of 15 minutes. Question 4. Set 4. Which condition is characterized by current jelly, stools, celiac disease, intussusception, Hirschsprung's disease, Crohn's disease? Intussusception causes stools mixed with blood and mucus, appearing like currant jelly. Question 5. Set 5. Which is a characteristic of croup? Productive cough, barking, seal-like cough, wheezing on expiration, high fever. Croup is characterized by a distinctive barking cough caused by laryngeal edema. Question 6. Set 6. What is the purpose of administering magnesium sulfate to a preeclamptic patient? To lower blood pressure, to prevent seizures, to induce labor, to increase fetal lung maturity. Magnesium sulfate is the drug of choice for seizure prophylaxis in preeclampsia/eclampsia. Question 7. Set 7. Which is a common side effect of radiation therapy to the head and neck? Diarrhea, xerostomia, hematuria, clubbing of fingers. Xerostomia, dry mouth, is common when salivary glands are in the radiation field. Question 8. Set 8. What is a classic sign of appendicitis? Left upper quadrant pain, rebound tenderness at McBurney's point, pain relieved by eating, hematmesis. Pain in the right lower quadrant with rebound tenderness, McBurney's point, is classic for appendicitis. Question 9. Set 9. A patient is experiencing an acute manic episode. What is the priority? Involving them in group therapy, providing a high-calorie, finger food diet, teaching coping skills, encouraging social interaction. Manic patients have high energy and may not sit for meals. Finger foods provide necessary nutrition while on the move. Question 10. Set 10. Which fetal heart rate pattern is most concerning? Early decelerations, late decelerations, accelerations, moderate variability. Late decelerations indicate uteroplacental insufficiency and are non-reassuring. Question 11. Set 11. A patient on chemotherapy has a platelet count of 20,000. What is the nurse's priority? Infection control, bleeding precautions, managing nausea, increasing protein intake. Thrombocytopenia, low platelets, puts the patient at high risk for bleeding. Question 12. Set 12. What is the therapeutic level for lithium? 0.1 to 0.5 milliequivalent/L, 0.6 to 1.2 milliequivalent/L, 1.5 to 2.5 milliequivalent/L, 3.0 to 4.0 milliequivalent/L. The maintenance therapeutic range for lithium is 0.6 to 1.2 milliequivalent/L. Question 13. Set 13. A patient with alcohol withdrawal is tremulous and agitated. What medication is usually prescribed? Disulfiram, chlordiazepoxide, methadone, bupropion. Benzodiazepines like chlordiazepoxide, Librium, are used to manage alcohol withdrawal symptoms. Question 14. Set 14. A patient is post-bronchoscopy. What is the nurse's priority assessment? Pain level, gag reflex, urinary output, blood pressure. The gag reflex must return before the patient can safely eat or drink to prevent aspiration. Question 15. Set 15. HbA1c levels reflect glucose control over what period? 24 hours, 1 week, 3 months, 1 year. HbA1c measures the percentage of glycated hemoglobin over the 120-day lifespan of red blood cells. Question 16. Set 16. A patient with type 1 diabetes is shaky and sweaty. What should the nurse do first? Administer insulin. Check the blood glucose level. Give 15 g of simple carbohydrates. Notify the provider. Assessment of blood glucose is the first step when hypoglycemia is suspected. Question 17. Set 17. What is the primary characteristic of anorexia nervosa? Binging and purging, distorted body image and self-starvation, excessive sleeping, fear of spiders. Anorexia involves a refusal to maintain a healthy weight and a distorted perception of one's body. Question 18. Set 18. Standard precautions apply to which of the following? Only patients with known infections. All patients regardless of diagnosis. Only patients in ICU. Only surgical patients. Standard precautions are used for all patients to prevent cross-contamination. Question 19. Set 19. Which medication is used to treat a suspected opioid overdose? Naloxone, flumazenol, atropine, epinephrine. Naloxone, Narcan, is an opioid antagonist. Question 20. Set 20. A mother is Rh negative and her baby is Rh positive. When should she receive RhoGAM? At 28 weeks and within 72 hours of delivery. Only at delivery. Only if she has a second child. At every prenatal visit. RhoGAM is given to prevent isoimmunization in Rh negative mothers.